Have you ever been prescribed Cefadroxil and wondered what it really does to your body? You're not alone. Millions of people take this antibiotic every year, but most don't understand how it works or what to expect. Here's the truth. Many people take antibiotics without really knowing what they're putting into their system. They trust their doctor, which is good, but understanding your medication is even better. That's why in the next 8 minutes, you'll learn everything you need to know about Cefadroxil. We'll cover exactly what it is, how it fights infections in your body, the real benefits you can expect, and the side effects you should watch out for. By the end of this video, you'll be completely informed about this powerful antibiotic. So let's dive in. So what exactly is Cefadroxil? Let me break it down for you in simple terms. Cefadroxil is what doctors call a first-generation cephalosporin antibiotic. Now, that sounds complicated, but it's really not. Think of it as a specific type of germ-fighting medicine that's been around since the 1970s. You might know it by its brand names. The most common ones are Duracef and Ultracef. But whether you see the generic name Cefadroxil or these brand names, it's the same medication. Here's something really important to understand. Cefadroxil only fights bacterial infections. It does absolutely nothing against viruses. So if you have a cold, the flu, or COVID, this antibiotic won't help you at all. Your doctor prescribes it specifically for bacterial problems. You can get Cefadroxil in 3 different forms. There are capsules that you swallow whole. There are tablets that you can sometimes break or crush if needed. And there's also a liquid suspension, which is especially helpful for children or people who have trouble swallowing pills. The liquid form tastes pretty mild, which makes it easier for kids to take. Many parents appreciate this because getting children to take medicine can be a real challenge. Now let's talk about how Cefadroxil actually fights infections in your body. Understanding this will help you see why it's so effective. Think of bacteria as tiny invaders with protective armor around them. This armor is called a cell wall, and it's what keeps the bacteria alive and strong. Cefadroxil works like a special weapon that breaks down this protective armor. When you take Cefadroxil, it travels through your bloodstream and finds the harmful bacteria. Then it attacks their cell walls, causing them to weaken and eventually die. Without their protective walls, the bacteria can't survive in your body. Cefadroxil is particularly good at fighting what doctors call gram-positive bacteria. These are common germs that cause many everyday infections. It's like having a specialized tool that's perfect for specific types of problems. Here's what you can expect timeline-wise. Most people start feeling better within 48 to 72 hours of taking their first dose. That's pretty fast when you think about it. Your body begins winning the fight against infection in just 2 to 3 days. But here's the crucial part. Even if you feel completely better after a few days, you must complete the entire course of medication. This usually means taking it for 7 to 14 days, depending on what your doctor prescribed. Why is this so important? Because stopping early can lead to antibiotic resistance. The remaining bacteria can come back stronger and harder to treat. Always finish the full course, even when you feel great. Let's explore exactly what conditions Cefadroxil can treat. This information will help you understand why your doctor might prescribe it. First, let's cover the most common infections. Cefadroxil is excellent for skin and soft tissue infections. This includes cuts that have become infected, cellulitis, and wounds that aren't healing properly. Many people get these types of infections from minor injuries. It's also very effective for urinary tract infections, commonly called UTIs. If you've ever had burning during urination or frequent trips to the bathroom, you know how uncomfortable UTIs can be. Cefadroxil can clear these up quickly. Throat infections are another common use. This includes pharyngitis, which is inflammation of your throat, and tonsillitis, which affects your tonsils. Both can make swallowing painful and leave you feeling miserable. Respiratory tract infections also respond well to cefadroxil. These affect your breathing passages and can cause coughing, chest discomfort, and difficulty breathing. Now, let's talk about some special uses you might not know about. Dentists sometimes prescribe cefadroxil before certain procedures to prevent heart valve infections. This is especially important for people with heart conditions. It's also prescribed for impetigo, a skin condition that causes red sores and is common in children. Some kidney infections can also be treated with cefadroxil, though this depends on the specific type and severity. However, there are important things cefadroxil cannot treat. Remember, it doesn't work against viral infections like colds, flu, or COVID-19. It also can't treat fungal infections like yeast infections or athlete's foot. And it's not strong enough for severe hospital-acquired infections, which often require more powerful antibiotics. Now let's discuss why cefadroxil is such a popular choice among doctors and patients alike. These benefits make it stand out from other antibiotics. First, it's what we call broad spectrum. This means it can treat multiple types of bacterial infections effectively. Instead of needing different antibiotics for different problems, cefadroxil can handle many situations. This versatility makes it a reliable first choice for many doctors. The oral form is a huge advantage. You can take it at home without needing injections or hospital visits. This makes treatment much more convenient and comfortable. No painful shots or IV lines required. The dosing schedule is another major benefit. Most people take cefadroxil just once or twice daily. Compare this to some antibiotics that require 4 doses per day. This simple schedule makes it easier to remember and stick to your treatment plan. Safety across age groups is impressive. Children can take it safely, and so can elderly patients. This flexibility means families can use the same medication for different members when appropriate. Of course, dosing varies by age and weight. For pregnant and breastfeeding mothers, cefadroxil is generally considered safe. This provides peace of mind during times when medication choices are limited. However, always consult your doctor before taking any medication during pregnancy. Finally, it can be a good alternative for people with certain penicillin allergies. While not everyone with penicillin allergies can take cefadroxil, many can. This provides another treatment option when the most common antibiotics aren't suitable. These combined benefits make cefadroxil an excellent choice for treating bacterial infections safely and effectively. Getting the dosage right is crucial for cefadroxil to work effectively. Let me walk you through the standard dosing guidelines. For adults, the typical dose ranges from 1,000 to 2,000 milligrams daily. Your doctor might prescribe this as a single daily dose or split it into 2 doses taken 12 hours apart. Both approaches work well, so follow whatever your doctor recommends. Children's dosing is calculated differently. It's based on body weight at about 30 milligrams per kilogram of body weight per day. So a heavier child gets more medication than a lighter child. Your pediatrician will calculate the exact amount needed. Here's some good news about taking cefadroxil. You can take it with food or without food. It doesn't matter. Some people find taking it with food helps prevent stomach upset, while others prefer taking it on an empty stomach. Do whatever feels better for you. Timing is important, though. Try to take your doses at the same times each day. This helps maintain steady levels of the medication in your body. Set phone reminders if you need to. Most treatment courses last 7 to 14 days. Your doctor will specify the exact duration based on your specific infection. Mark your calendar so you know exactly when to finish. Here's the most important rule. Never skip doses and never stop taking the medication early, even if you feel completely better. Completing the full course prevents the infection from returning and reduces the risk of antibiotic resistance. If you miss a dose, take it as soon as you remember, unless it's almost time for your next dose. In that case, skip the missed dose and continue with your regular schedule. Let's talk honestly about side effects. While Cefadroxil is generally well tolerated, like all medications, it can cause some unwanted effects. Knowing what to expect helps you stay prepared. The most common side effects are usually mild and manageable. Diarrhea tops the list. About 10 to 15% of people experience loose stools while taking Cefadroxil. This happens because the antibiotic affects the normal bacteria in your digestive system. Nausea and stomach upset are also fairly common. You might feel queasy or have general stomach discomfort. Taking the medication with food often helps reduce these symptoms significantly. Some people develop a rash or skin irritation. This usually appears as mild redness or small bumps on the skin. Most of these reactions are not serious and go away after finishing the medication. Headaches and dizziness can occur too. These are typically mild and don't interfere much with daily activities. Staying hydrated and getting adequate rest usually helps. Now let's discuss the serious side effects. These are rare, but it's important to recognize them. Severe diarrhea with blood is a major red flag. This could indicate a dangerous condition called C. diff infection, which requires immediate medical attention. Allergic reactions can range from mild to life-threatening. Watch for hives, difficulty breathing, or swelling of your face, lips, or throat. These symptoms require emergency medical care. Severe skin reactions are uncommon but serious. This includes extensive rashes, blistering, or peeling skin. These reactions can be dangerous and need immediate medical evaluation. Liver problems can occur, though rarely. Watch for yellowing of your eyes or skin, dark urine, or severe stomach pain. These could indicate liver complications. Kidney problems are also possible, especially in people with existing kidney disease. Symptoms include changes in urination, swelling, or unusual fatigue. Here's when to call your doctor immediately. If you have watery or bloody diarrhea, severe allergic reactions, difficulty breathing or swallowing, chest pain, a fast heartbeat, or any signs of liver problems, don't wait. Seek medical help right away. Remember, most people take Cefadroxil without experiencing serious side effects. But staying informed helps you respond quickly if problems arise. Before taking Cefadroxil, there are important warnings and precautions you need to know about. This information could prevent serious complications. Allergies are the biggest concern. Always tell your doctor about any allergies to penicillin or other cephalosporin antibiotics. While Cefadroxil is different from penicillin, some people who are allergic to penicillin may also react to Cefadroxil. Your doctor needs this information to prescribe safely. Certain medical conditions require special caution. If you have kidney disease, your doctor might need to adjust your dose or monitor you more closely. The kidneys help remove Cefadroxil from your body, so kidney problems can affect how the medication works. If you have a history of colitis or severe diarrhea, tell your doctor. Cefadroxil can sometimes trigger these conditions or make them worse. Your doctor might choose a different antibiotic or monitor you more carefully. Drug interactions are another important consideration. Cefadroxil can affect how blood thinners like warfarin work, potentially increasing bleeding risk. It may also reduce the effectiveness of birth control pills, so discuss backup contraception with your doctor. For pregnancy and breastfeeding, Cefadroxil is generally considered safe, but always consult your healthcare provider first. They can weigh the benefits against any potential risks for your specific situation. Regarding alcohol, there are no major dangerous interactions, but alcohol might worsen stomach upset or nausea. It's probably best to limit alcohol while taking the medication. Always provide your doctor with a complete list of all medications and supplements you're taking to avoid potentially harmful interactions. Let me leave you with some practical tips that will help you get the best results from Cefadroxil treatment. First and most important, complete the full course even if you feel completely better. This cannot be emphasized enough. Stopping early can lead to recurring infections that are harder to treat. If you have the liquid form, store it in the refrigerator. Room temperature storage can cause the medication to lose its effectiveness. Also, throw away any unused liquid after 14 days. Never share your Cefadroxil with family members or friends, even if they have similar symptoms. Each person needs their own prescription with the right dose and duration. Consider taking probiotics during and after your treatment. These can help restore the healthy bacteria in your digestive system and reduce the risk of diarrhea. Keep all your follow-up appointments with your doctor. They need to make sure the infection is completely cleared and that you're not experiencing any concerning side effects. Finally, if you have any questions or concerns during treatment, don't hesitate to contact your healthcare provider. They're there to help ensure your treatment is safe and effective. So there you have it. Everything you need to know about Cefadroxil in just 10 minutes. This is a powerful and effective antibiotic when used properly. It can clear up bacterial infections quickly and safely for most people. The key takeaway is simple. Always follow your doctor's instructions exactly. Take the full course, even when you feel better. Watch for side effects, but don't be afraid of this medication. Millions of people take it successfully every year. Have you been prescribed Cefadroxil before? I'd love to hear about your experience in the comments below. Did it work well for you? Any side effects you noticed? Your stories help other viewers make informed decisions. If this video helped you understand Cefadroxil better, please give it a thumbs up and subscribe for more medication guides like this one. We break down complex medical information into simple, practical advice you can actually use. Remember, this video is for educational purposes only. Always consult your healthcare provider for personalized medical advice. They know your specific situation best and can guide you safely through your treatment. Thanks for watching, and here's to your health and recovery.